Good morning, everyone, and welcome to Nevada's Recovery Advocacy Day 2021. My name is Ryan Hampton, and I'm a person in long-term recovery. I'm also the organizing director at the Recovery Advocacy Project here in Las Vegas. We are so grateful and we are so thrilled that so many are joining us here for our virtual Advocacy Day on Zoom. And to everyone who's joining us on Facebook, welcome. We're very glad that you're here. Before we get started, I think it's critical that we hold space and recognize the importance of the work that every single person on this call is engaged in. Now more than ever, the addiction and mental health recovery communities need to come together, creating connection and creating community at scale due to the devastating impact of COVID. This morning is one of the first opportunities that we have to do just that. The work that we do together as vaccines are becoming more widely distributed and our economy is beginning to open back up will be a testament to the resiliency and the strength of our community. Our nation and our state are on the verge of another historic high in mortality rates due to overdoses and suicide. Just 2 weeks ago, the CDC announced for the 12 months ending in September 2020, close to 90,000 Americans lost their lives due to overdose. It goes without saying that the access to critical recovery support services, the very services that saved my own life, must be available to every single Nevadan that seeks them. That's the work that we're focused on every day at the Recovery Advocacy Project. And on behalf of our entire team, we're grateful for the support, the vision, and the passion that so many of you have offered to our organization throughout this twin pandemic. Together, we are committed to giving people in recovery from all pathways, family members, and supporters of recovery the grassroots tools to think and act locally. We will continue to work towards building a visible and an effective constituency in demand of community and public policy-based solutions in response to Nevada's overdose and mental health crisis. Today is our opportunity for you to meet your legislators and leaders in our state and to create visibility as people who are the recipients of Nevada's behavioral health systems and services. You know, we've made great strides here in Nevada, but we still have so much further to go. So again, thank you for being here. The Recovery Advocacy Project is proud to help bring this important day to you, albeit virtually, and we look forward to being back together in person sooner rather than later. I'd now like to introduce our co-host organization, Foundation for Recovery, and their executive director, Sean O'Donnell.
Thank you, Ryan. It's so great to see everyone here today. I see many familiar faces and many new ones. I'm Sean O'Donnell. I'm the executive director of Foundation for Recovery. We are Nevada's statewide recovery community organization, a nonprofit led and organized by a diverse network of people and families in recovery. Recovery Advocacy Day is a statewide call to the thousands of people in Nevada living in recovery and those impacted by substance use and mental health to show up shoulder to shoulder and be visible as a robust constituency to our policymakers. Each legislative session, we organize around the issues that have directly impacted our lives: housing, access to treatment and healthcare, justice reform, community recovery supports, record expungement, overdose prevention and syringe access, and so many more. It's an opportunity to speak up about necessary changes to our behavioral health system and applaud the work of our legislators and members of public office who have helped us move a little more in the right direction. As Ryan had mentioned, we're in a time of record high deaths of despair, those caused by suicide and drug overdose. I believe that we are the solution to our country's long-standing addiction crisis. For decades, those of us with lived experience have organized mutual aid networks to support each other when other services have been simply inaccessible. It's time that we step into the open as people in recovery, to share our stories of loss, to share our struggles, to share our stories of being stigmatized, and most importantly, to share our stories of resilience, triumph, and strength. Addiction impacts 1 in 3 American households. When we mobilize and step out from behind the shame that shrouds our connectedness, we help the next person do the same. We begin to normalize the conversation and make it exponentially easier to reach and support the next person who is struggling. As we continue to strengthen our behavioral healthcare system, we must also expand recovery support in our communities, within our workplace, our places of worship, colleges and schools, and our everyday environments. After all, we are your neighbors, your family members, your students, your employees, your customers, your nurses, and your teachers. Today, we'll be joined by some of your elected officials. You'll hear from members of the community and learn about ways you can get involved after Recovery Advocacy Day. I'll close with a message for anyone who may be struggling today, or maybe you recently lost someone close to you. You are not alone. You are strong, and you are among a whole community of people just like you, reaching out to help whenever you need it. Thank you so much to everyone for being here. And with that, I'll turn it back over to you, Ryan.
Thank you, Sean, and thank you for the work that Foundation for Recovery does every single day for folks all across this state. It is now my honor to introduce our first guest this morning, and we are incredibly grateful for him taking time out of his busy schedule, not to mention right in the middle of legislative session, to join us today. His presence here with us at Recovery Advocacy Day shows that leaders from all across Nevada, even at the executive branch, are paying attention to the work you all do and are committed to working with the recovery community as we navigate coming out of these twin public health crises, COVID and the overdose and suicide crisis. On behalf of all joining our Advocacy Day this morning, I'd like to welcome to the virtual stage our 30th and current governor of the state of Nevada, Steve Sisolak. Governor, welcome to Recovery Advocacy Day.
Thank you, Ryan. I appreciate it. Hello, everyone. I am your governor, Nevada Governor Steve Sisolak. First and foremost, I would like to thank everyone from the Foundation for Recovery and the Recovery Advocacy Project for inviting me here today with you to even speak virtually. Recovery Advocacy Day is undoubtedly an important day for Nevada as it allows individuals and families recovering from substance abuse disorder and mental health challenges to address their legislators and create visibility. In the United States, 1 in 3 American households are impacted by addiction. 1 in 3. Between May 2019 and May 2020, the CDC has reported the highest record of drug overdoses in the country at 81,000 lives lost. The voices of Nevada's recovery community have ensured resources and funding are focused on the communities and services most in need. Over the last few legislative sessions, your advocacy has led to the passage of important policies. Since the Good Samaritan overdose law passed in 2015, many of your organizations have worked to train Nevadans how to respond to an overdose and have been distributing life-saving naloxone kits to the community. Between February 2018 and September 2020, 13,185 kits were distributed. That's more than 25,000 doses. Last session, your work on the ground led to the passage of the anti-stigma bill, which amended language in state law to remove harmful words like addict and alcoholic, and instead use person-centered language when referring to people with substance use disorders. Your advocacy on topics such as peer recovery support, mental health parity, and harm reduction will continue to move Nevada in the right direction. I firmly believe that those closest to the issue are closest to the solution. This is why it's important that people with lived experiences have a seat at the table and work with experts, researchers, and providers, and other professionals as we strengthen the continuum of care in our state. As a community, we are breaking the stigma of addiction by sharing our stories and highlighting the resilience of people in recovery. Recovery doesn't happen in a vacuum. It happens in our communities and must be embedded within our schools, places of worship, neighborhoods, and the workplace. That is why today I'm proud to announce the launch of the Nevada Recovery Friendly Workplace Initiative. This is a collaborative effort between Foundation for Recovery, Nevada's statewide recovery community organization, the Department of Health and Human Services, Division of Welfare and Social Services, and employers across the state. The initiative empowers employers to implement recovery-friendly practices within the workplace and provides support for people in recovery from substance use disorder, SUD, as well as all those impacted. The Recovery-Friendly Workplace Initiative encourages healthy and safe working environments where employers and employees and communities collaborate to create positive change, eliminate stigma, and support recovery in the workplace and in the community. The annual cost in Nevada for substance misuse, most of which is incurred by business, is $6.8 billion. These costs are attributed to reduction in labor force, decreased productivity, turnover, absenteeism, healthcare, and criminal justice. The Recovery-Friendly Workplace Initiative connects employers to resources and gives them guidance and support from recovery-friendly ambassadors as they take steps towards implementing recovery-oriented practices within their workplace, including free and customized staff training. Employers that join in this initiative will receive designation as a recovery-friendly workplace from my office. This initiative strengthens Nevada's communities by bringing those on the margins of society into stable and productive roles. When people are able to work, their contribution impacts their families, their neighborhoods, and the entire state. Thank you once again for having me. And thank you all for being part of the solution and recovery movement in the state of Nevada. I wish you all the best, and please continue your great work. You make an enormous difference on the lives of so many people. God bless.
Thank you, Governor, for that incredible message, and thank you for the very exciting announcement. And thank you for standing up for the recovery community here in Nevada. We're grateful for your partnership, and we look forward to continuing this important work together in the coming months and years. I'd like to now pass the program back over to Sean O'Donnell with Foundation for Recovery to introduce our next guest, who will also be presenting the Governor's Proclamation. Sean?
Thank you, Ryan. And thank you, Governor Sisolak. We are so excited to be launching this new initiative with support from your office and our partners at the Department of Public and Behavioral Health and the Department of Welfare and Social Services. You know, I wish that when I was looking for employment after treatment, these types of opportunities would have existed. I never felt comfortable being open in the workplace about my recovery status. I'd always felt ashamed and thought that it was something in my past that no one needed to know about. But what if instead my recovery was celebrated? What if that could have opened up connections with other employees who are currently struggling, who now felt comfortable to ask for help? We can't wait to grow this initiative across our state and continue to work with our early adopters, our pioneer employers who want to become one of the first recovery-friendly workplaces in Nevada. Thank you for all of your support. Next, we'll hear from a longtime champion of recovery communities. She has consistently worked to bring people with lived experience to the table when key decisions are being made that will affect our community. Time and time again, she has shown up to listen to us and has truly helped to foster a collaborative working dynamic between the state and the community. Please welcome Dr. Stephanie Woodard, Senior Advisor on Behavioral Health at the Nevada Department of Health and Human Services. Dr. Woodard, the floor is yours.
Thank you. And thank you, Sean, for such a wonderful introduction. I'm so honored to be here today to highlight some of the important work that's happening in the world of recovery here in the great state of Nevada. In addition to the exciting new recovery-friendly workplace initiative that the governor just launched, recovery support and services are essential assets in our communities and within our behavioral health system. Nevada recognizes that there are many pathways to recovery, and every individual seeking and maintaining recovery has a right to chart their own path, free from discrimination, with the necessary support to help them with self-determination so that recovery can be a process that can be supported by others with lived experience. As such, we believe that recovery supporting policies and programs must be available across our communities in Nevada, where people work, play, worship, and live. Through our partnerships with recovery organizations such as Foundation for Recovery and NAMI, Nevada has been able to integrate peer recovery supports across our behavioral health programs and integrate them into the fabric of our communities. I want to just highlight a couple of these very important programs that have touched the lives of thousands of individuals and is making a difference in saving lives every day. Through the Empowered and Mother programs down in Southern Nevada, we have peers that are working to help pregnant and parenting moms struggling with opioid use disorder navigate care systems, obtain prenatal care, and have safer and healthier pregnancies, with the greatest outcome being ensuring that those families can safely stay together as moms and babies move home and enter into that postpartum period. We also have a warm line that NAMI has been able to establish for us. This warm line is available to individuals and families who are struggling with behavioral health issues and mental illness that are seeking support here and now from someone with lived experience that, again, can help them navigate through some of the challenges that they face. Stigma reduction is a very important piece of the work that we're doing related to recovery. And this is done through public service announcements, ad campaigns online, as well as offering opportunities for individuals with lived experience to have their voices be heard, so that we can ensure that those individuals who are seeking recovery and struggling with substance use understand that there is hope and there's treatment and support available. We have mobile recovery outreach teams that are going into emergency rooms, working with individuals who have struggled with a non-fatal overdose to help them engage and offer support with the possibility of helping them enter into treatment, but more importantly, really focused on helping those individuals continue to stay alive and achieve the level of recovery that they seek. Zero suicide is another big initiative where we're working with large hospitals and healthcare systems. And this initiative is actually led by an individual with her own lived experience. And it is through her own voice and her experience that she has been able to engage over 18 large hospitals and healthcare systems in our state who have made reaching zero suicide a core tenet of the policies that they're going to continue to put forward. It is also important that we do continue to offer opportunities for individuals in voices of recovery to have a seat at the table, to guide us in the development of our programs and our policies, to ensure that all decisions that are made related to recovery supports and treatment services are guided by those individuals with the experience that can help us to better understand what is needed and what is desired, so that we can develop those programs and policies with the person who is using them in mind. It doesn't help if we're developing programs and policies that really don't resonate with the individuals that need them the most. So ensuring that we continue to have voices of those in recovery at the table is a core priority for us. I also just want to speak a little bit about what we do also have on the horizon, because this collaborative effort is one that continues to grow and change. As you know, there are some policies that are being contemplated right now with a lot of advocacy around them, around the certification for peer recovery support services. Peers need a pathway to be able to enter a career where the value that they bring with the lived experience and the support that they can provide individuals who are moving through the treatment system is very essential. In addition to that, looking at opportunities to grow and develop recovery housing, where individuals who are actively engaged in recovery can live and be in safe and sober environments with other individuals being supported throughout their recovery process. As we move forward, we're hopeful that we continue this very collaborative and dynamic work with our recovery communities, as well as all individuals that would like to join us in developing systems and supports that are responsive for individuals in recovery. And with that, Sean, I would like to be able to read the governor's proclamation.
Yes, please. Thank you, Stephanie.
So, a proclamation by the governor. Whereas the recovery advocacy movement is a social movement led by people in addiction recovery and their allies, aimed at altering public and professional attitudes toward addiction recovery, promulgating recovery-focused policies and programs, and supporting efforts to break intergenerational cycles of addiction and related problems. And whereas Nevada's recovery advocates are committed to smashing the stigma that surrounds substance use disorder, shaping public policy, and educating the public, policymakers, and service providers about the prevalence, pathways, and styles of long-term addiction recovery. And whereas recovery advocacy represents hope-powered community and is about replacing misinformation with understanding, misperception with empathy, and denial with hope. Whereas major strategies of Nevada's recovery movement include building strong grassroots recovery community organizations, advocating for meaningful representation and voice for people in recovery and their families at local and state policy levels that affect their lives, and assessing and responding to state and local needs related to the advocacy and quality of local treatment and recovery support services. And whereas the recovery advocacy movement is positively altering public and professional perceptions of addiction recovery and forging fundamental changes in the design of addiction and the nature and magnitude of recovery support services available to Nevada citizens. This proclamation was signed by Steve Sisolak, Governor of the state of Nevada, declaring April 27th, 2021 as Recovery Advocacy Day.
Thank you so much, Dr. Woodard, for your words and your continued support of our families and community. And a huge appreciation to Governor Sisolak again for the proclamation of Recovery Advocacy Day 2021. Today really is about smashing that stigma. And on that note, we have an incredible group of recovery advocates joining us today to share some of their stories of resilience and hope. On today's Recovery Stories panel, we have Susie Cerno, a mother and tireless recovery advocate, Darcy Patterson, a mother, woman in recovery, and founder of Wake Up Nevada, Finn Tystand, and Alvin Elliott. Welcome to all of our panelists. So let's go ahead and start. I just want to go around and have each of you do a little introduction, explain a little bit about what you're doing in our state and how you identify and how you're connected to the recovery movement in Nevada. Susie, we can start with you.
Okay, good morning, everyone. Well, my story starts about 12 years ago when I realized I was the mom of a son with substance use disorder. But fear not, I'm a mom, and moms fix everything, and that's what I set out to do. So I did everything I could to help my son. I thought I was helping. Like, for example, one day he needed a shirt for work, so I left my work to help him. And I remember one night, he told me he had to pay off some guy, and if he could do that, he'd be safe, and this guy wouldn't bother him anymore. So I drove him to this apartment complex where he was to pay this guy the money he owed him. And there I was alone in the dark, and I was so afraid that I hid all crouched up under the dashboard of my car while my son was away. Another time, under the same circumstances, I drove my son to a nice gated community. I was calmly waiting in the car when suddenly the door flings open. My son dives into the car shouting, "Go, go, go." And I drove all over the place and I couldn't find the gate. And I was too scared to look in the rearview mirror for fear someone was behind us. Well, I realized after all these adventures, I wasn't paying someone the money we owed them. I was driving my son to places where he could buy drugs. And my heart was broken, Sean, and I was sad. And my dreams for my son were gone. And I had to admit I couldn't fix this. And that's what brought me to the recovery community. I started changing my thinking. I got rid of the stigma that caused me to be embarrassed and ashamed, and I'm not embarrassed or ashamed anymore. And I'm not fearful of the harsh judgment of others anymore either. I recognize now that addiction is a disease, and the fact that my son has this disease is not my fault, and I didn't fail as a mother. So then I realized, Sean, that I needed a voice. And that's when I joined Recovery PAC. And after that, I joined Recovery Advocacy Project. And after that, Nevadans for the Common Good, where I started my own addiction and recovery group. And that's kind of what brought me here today, Sean. I'm hoping everyone in this group can find their own voices and we can build a community that puts the right supports in place. And it's a community filled with the help and helping and protecting people with substance use disorders. And I'm hoping we can build a community where everyone can become the best they can be.
Thank you, Susie. And I loved what you said about, you know, when that critical moment when you realize that you didn't fail as a mother. I think that's so important for people who are tuning in today to hear. I know that me personally, my recovery journey actually started when I was an adolescent in high school. That was the first time that I went to detox and treatment. And I know that my mom and my parents felt the same, they felt a similar way, right? What did we do wrong? Where did we go wrong? And they really needed to also find that empowerment within themselves to understand that they didn't do anything wrong, right? That addiction is a disease and that recovery is possible and that there's hope, you know? Thank you, Susie, so much for sharing a little bit about your story and the work that you're doing in our community.
You're welcome.
Darcy.
Yes, my name's Darcy Patterson. Thank you for having me today. I actually attended the first Recovery Advocacy Day in Carson City when we could all be together, and it was amazing. I met a lot of wonderful people, and I've been an advocate for quite a while. I really, enhanced my recovery advocacy when my daughter died of a heroin overdose, March 1st, 2017. I also myself am a person in long-term recovery. I have 6 years and continue to reach out and help others in recovery and find sobriety and find the services that they need in our community. One thing that I've been really privileged to be a part of is Wake Up Nevada. And that is an initiative that comes from the Reno Police Department and is funded by the justice system. And we've been able to put out information, resources. We have a website. We also have a Facebook group that you can belong to, and other services that people can reach out and get the things that they needed. Early in my daughter's use, I really reached out to find some help and to find some support and to find something that I could really hold on to so that I could help my daughter. And there really wasn't a lot at that time. So I was, so I reached out and I found what I could find. And then when I came into recovery and my daughter got further into, the Recovery Advocacy Project and other things, I realized that these are the resources that I needed way back when, she was first using, and that was the support I was missing. And I am so thankful that today, if someone asks for that help, someone reaches out, someone needs a mom to understand, or someone who's in recovery to understand their story, that we're here for them. And there's so many people in this state of Nevada that are pro recovery and stepping out and doing their part to support our, recovery community and be a part of what we do. Thank you for having me today, and I appreciate everybody on the panel.
Thank you, Darcy. Thank you for being here, and thank you for being vulnerable and sharing that part of your story and some of the work that you're doing with Wake Up Nevada and a few other groups. It's such important work, and I really liked what you had to say about reaching out and finding help and connecting with people that have been through similar experiences, right? And that's really what peer support's all about. That's the value and that's the strength of people in recovery reaching out to other people in recovery, to that recovery community. And same thing with parents reaching out to other parents who have been through similar experiences and being able to relate and have someone that understands what you're going through. So thank you, Darcy. Finn, would you mind introducing yourself and explaining why you stand up for recovery and a little bit about your story?
Hi, my name is Finn Tystad. I'm an addict in recovery. I'm 19 years old. I attend Mission High School, which is a high school that caters to young people in recovery, gives them a platform to not only recover, but surround them with counselors, other people in recovery, and other young people who are also attaining the same goal, which is something you can't really get in a public high school nowadays, unfortunately. I also attend APG, which is the Alternative Peer Group, which does something similar, gives all these kids 15, 16, 17, 18 years old a place to go, hang out, have fun experiences without the use of drugs, which has been, wildly successful through my life and the people around me's life. It shows kids that, life does not have to, involve these substances in order to have a good time. I'm doing all of this because as someone so young in recovery, I almost feel like, the black sheep, because nowadays, especially being young and using substances almost seems like what you do. It's what every kid does and what they think they need to do. And it's causing a lot of death. It's causing a lot of despair in these lives. So as someone who has that experience of coming into recovery, going to rehab at 16, 17 years old, I feel like I have a powerful voice that kids would want to listen to me, hear something from lips of their own, someone who is also young, to help them maybe get the message a little better than someone who they don't see as a peer. So I like to use my voice as that.
Thank you, Fenn. And I relate so much to a little bit of the story and like the pathway that you just described that you went through. I also went to treatment when I was, I think 16, 17 for the first time. And things like APG didn't exist, back when I went. And so I remember going to treatment and then just going right back into my same environment and not having other people in recovery I could connect with. And just like what you said, I felt like that black sheep, right? I felt like I didn't belong. I felt weird. Like everyone in school was like, that's the kid that went to rehab, right? He has a problem. And so it's really awesome that you're able to connect with your peers, other people, young people in recovery, and be able to have fun sober, and it's awesome that you're getting it at such a young age, so kudos to you. Thank you for being here. Alvin, do you want to go ahead and do a brief intro and why you stand up for recovery, your recovery story?
Good morning, everyone. My name is Alvin Elliott. I'm a person in long-term recovery. And that means for me, for the last 34 years and in a few months, 35 years, I've, had no drugs or alcohol. And I'm grateful for the path that I'm on in terms of my recovery. I am a part of the Recovery Advocacy Project endorsement group. So any candidates on this line that are looking to get into the legislature, I, help with that with Anna and others. I'm also a peer recovery specialist, and I'm also a facilitator for the CRAFT, which is the Community Reinforcement Family Training. I've been an advocate for recovery for the last 4 years, but I've been a volunteer and an advocate at the Foundation for Recovery for the last 11 years since I moved into the Valley from Washington, D.C. And, I just want to tell you all how, overwhelmed I am at sitting here. A person who, was, some 34 years ago, almost 35, trying to get into treatment. I'm sitting on a panel with the governor of the state, and, many others, talking about it. I want to get back at you, Sean. You have me come behind the youngest person probably on the panel to have me close out. But yes, coming into recovery, my pathway to recovery is a pathway of abstinence. many years of working with groups, 12-step recovery groups, in and around the country. Here in Nevada, I spent the last 10 years working at a great treatment center, Las Vegas Recovery Center, working with their alumni group, but also working in the community, planning on Alexon training with Track B and Chelsea up there, doing the outreach with Anna Maria Hernandez, out on Saturday and Sunday mornings, when the sun started to get hot. I'm thinking to myself, I can't walk with this young girl anymore. But, hanging little signs on there, advocating for recovery, wearing our T-shirts, crossing the partisan line, okay? Advocacy is a nonpartisan issue, right? It's not a Republican issue. It's not a Democratic issue. It's a human issue, right? And even though, I'm a dyed-in-the-wool liberal from back east, when it comes to recovery and recovery advocacy, I tell my friends and anyone that will listen that I will cross that line to vote for someone who supports what we support, and I put my actions, into my words into action, by doing that, by supporting candidates that I may not have all the same ideological and philosophical agreements with, but once it comes to legislation that goes up to Carson City, if they're voting with us, people are, in recovery, then I'm voting with them, and I'm hoping that we can continue on that line. Last year was a great year for us. Even though we were in COVID protocols, we still were getting out on the walkway, handing out literature. I was a part of the endorsement team. We had, endorsement. We were supporting candidates, and that is my passion, to do those things and continue to support, the citizens of the state of Nevada. I was listening to Darcy and talking about her daughter. I too lost a son. He was 21 years old, and so I feel that. As I look here at Finn, I say to myself, what would have happened if he'd have had a recovery high school to attend, where he didn't have to feel like he was an outcast, so he didn't have to feel like he was so different, But my goal today is to use that burn that I have, that passion that I have, to help people like him as they come along, but to help anyone that wants to come along, from 8 to 80. It doesn't matter if you're looking to get help with substance use disorder. I want to be one of the ones on the front of the line, helping pass legislation and getting the support that you need. And once again, I want to thank the governor for his announcement today of recovery-friendly workplace. Oh my goodness, the idea that a person can now go to work without fear of losing his job, because I see that day in and day out. People do not want their job to know because they're afraid that the stigma that surrounds substance use disorder, will prevent them from, making a living, and supporting their families. So thank you all for being here today for this wonderful, wonderful event. And thanks for allowing me to share.
Thank you, Alvin. As always, you hit everything, perfectly. You summarized a lot of great work that's going on in our community. And I really wish that we had more time to dive in because I had a whole lot of questions here to ask each of you. But we are at that time to keep moving on in the program. But I want to ask everyone, just before we move on, I know that this year has been particularly difficult for a lot of individuals. What would your advice be to anyone out there who's struggling, just as closing remarks? How have you maintained your recovery and your wellness over this past year?
I'll start this time since I ended real quickly. There are certain practices that I've developed over the years, of meditation, finding different things to do, therapy, networks. I mean, there are more networks now than ever before. Finding a network, going online to do that. There are more people like us than we think, and people who would like to join us. So as I scan the universe, the internet, I'm looking for people who are just like me, who can help support me, as we move through this crisis.
Thank you, Alvin. Susie, Darcy.
I would say something similar. I would say to other moms, find a support group. My support group really helped me. And now that we're online, you can find multiple support groups, but also there's great fulfillment in reaching out and being involved in other groups like Recovery Advocacy Project and other groups where you know that you are making a difference in helping others. So I would suggest to people to reach out.
Thank you, Susie. Great advice.
So maintaining recovery, I think, Sean, you also talked about in these hard times with COVID, and one of my things was to realize that there were things that I could change and what I couldn't change, and to realize that it was also a time of grief and to let myself grieve. But one of the things that helped me immensely was structure and routine, and reaching out to my friends that are in recovery, and joining the Zoom meetings that were available, putting the information out about those meetings that were available. Also, one thing that I do that helps me in my recovery is helping others with advocacy and reducing the stigma for those with substance use disorder and those who love them. I'm also involved in many mother groups, grieving groups on Facebook, and that really is a huge part of my recovery and a huge part of my advocacy. And I'm very thankful that there are groups, like Susie said, that we can reach out to, and that there are other moms and dads that can have the support, not only when their child is possibly out there still using, but if they've lost them to the substance use disorder like I have.
Thank you, Darcy.
For me, I can say personally that an addict alone with their own thoughts is not a good company. Get connected, stay connected, find a group where you fit in. That doesn't mean it needs to be my group or Elliot's group or Darcy's group, but find a group that you fit in and you feel comfortable, and stay connected, and get in the middle.
Awesome. Great advice. Thank you again for sharing your experience with us today, all of you. I really wish we had more time with each of you. And I want to take a moment now to give special thanks to all of our community partners who are doing just incredible life-saving work across Nevada. We have Nevadans for the Common Good, There Is No Hero in Heroin, the Alternative Peer Group in Las Vegas, Mission High School, Ridge House, Pact Coalition, Track B Impact Exchange, Nevada Institute for Mental Health and Addiction, Karma Box, Rural Nevada Counseling, Heart to Heart, and the National Alliance on Mental Illness Nevada, including the Southern, Northern, and Western Nevada affiliates. And those are just a handful of organizations doing life-saving work in our state, and we're so appreciative to be partnering with each of you and working with all of you. Next, we will be turning our program over to some of our legislative experts who've been instrumental in providing a finger on the pulse during this session to help us track bills, committee hearings, legislative deadlines, and provide support as we move key policies forward this year. Leah Tauchen and Trey Abney from the Abney-Tauchen Group will now give a quick legislative brief on some of the policies we've been tracking this session. Take it away, Trey and Leah.
Hey, thanks, Sean. Again, this is Trey Abney, the lesser half of the Abney-Tauchen Group, and you'll hear from my business partner, Leah Tauchen, here in a minute. Just wanted to give a brief kind of lay of the land of what's going on with the legislature. And so I'll go over kind of the 30,000-foot view, and then Leah will talk about some of the specific bills that we've been tracking and advocating for on behalf of this community. I mean, I guess I'll say to start that this has probably been the weirdest legislative session certainly that we've ever been a part of. Back, last late summer and fall, Governor Sisolak and his team proceeded to build a 2-year budget in the middle of a pandemic after the bottom had fallen out of Nevada's economy, and we had 30-something% unemployment. And so being that their crystal ball was very fuzzy at that point, certainly they did the best they could to build a budget, not knowing what kind of federal dollars will be flowing in. And that will happen. We know that a lot of federal stimulus dollars will be coming later. We just don't know how much yet. And so as we approached February, when session started, there was kind of this general understanding that this was going to be a budget session. There wasn't going to be a lot of time for big policy issues and big policy debates. However, that has proven wrong. We have had just as many bills and just as many policy discussions and debates probably as a regular session. The difference is until a couple weeks ago, we weren't even allowed to be inside the building and have those conversations. Everything, like life nowadays, everything has been done over Zoom up until, again, just these last couple weeks. So where are we? For those of you that tuned into kind of our grassroots legislative training sessions and updates, we're obviously on a 120-day legislative calendar, 120 calendar days, started February 1st, which means we are now at week 13. We've got 5 weeks to go until what they call sine die, which is where they gavel out for the session on May 31st. We have been through a couple of bill deadlines, but to my point earlier, there were still more than 1,100 bill draft requests that were submitted. There were 935 bills introduced, which is pretty close to being on track for previous session. And so we've had a lot of stuff to follow. It has not been, again, the slow and steady process that we thought. I mentioned bill deadlines because of the 120-day calendar. Again, the legislature meets 120 days every other year. They have to put deadlines in place in order to get all their work done. We've already passed the first deadline a few weeks back, which was first committee passage. So if you're an assembly bill, you had to get out of your first committee in the assembly. We passed first floor passage on April 20th, which means, again, if you're an assembly bill, you had to get off of the assembly floor, get passed and voted on the assembly floor, and move over to the Senate and vice versa. Now, there are always exceptions to all those rules. So there are plenty of bills that have been exempted from those deadlines because they have a budget piece to them, or they're worried about how much money it'll cost the state. But being that most of the bills, again, are stuck on a deadline schedule, the next one coming up on May 14th, which is second House committee passage. So if you were an assembly bill, you made it through your assembly committee, you were voted in favor off of the assembly floor, you're now in a Senate committee, and you have to get out of that committee by May 14th. And then a week or week and a half later, of course, would be your second House passage as we get rolling toward the end of session. Again, as I mentioned, up until 3 weeks ago, we had to do everything by Zoom. You would testify and call in by Zoom. My friend Sean O'Donnell knows that very well, having had to do that several times now. We appreciate his hard work on advocating on behalf of the recovery community. We can now enter the building, but you have to show a vaccination card. You have to or get a vaccination before you walk in, or get a test before you walk in. And so it's still very limited. Each legislator can only have one person per day come visit them, which really limits the ability for folks to come and visit. So that's just kind of a lay of the land. I will hand it over to Leah for the smart stuff, and she'll tell you about some specific bills that we've been following for you. Leah, go ahead.
Good morning. Thank you so much for joining us. We just wanted to take an opportunity to discuss some of the recovery-friendly legislation that we've seen this session. And I will tell you, Trey and I have been fortunate enough to work with the Recovery Advocacy Project and Foundation for Recovery for the last 2 sessions. And just watching the number of recovery-friendly bills grow each session is just a testament to what all of you are, the importance of the work that you're all doing and the time that you're spending with us today. And so Trey mentioned the deadline that we just passed. We've got a couple of bills that are important to us, that are at on the priority list of our bill tracker. And one of them being Assembly Bill 374, which is Jill Toll's bill to create a statewide substance use response working group. And this one is just so important because 2 sessions ago, we saw the creation of the regional behavioral health policy boards. And the important work that's being done there, where they're driving bills that are behavioral health related, a lot of times have components to substance use. And so now we're seeing this session, another group, this statewide substance use response working group that will incorporate, as you heard Dr. Woodard and Governor Sisolak talk about, tapping into that lived experience and having advocates at the table sharing their story. And also, it keeps the momentum when we're not in session to have these groups that are going to work all year round, every year, whether we're in session or not. And in this bill specifically, why it's so important is it's a 16-member board being created, and there are a number of positions on that board that will be those voices that we are, the lived experience voice at the table. And so we're just so excited to see that that is being considered and that the legislators are incorporating that into legislation, that it's at the top of their mind. And so in this bill specifically, it calls out that there will be an advocate for persons who have substance use disorders and family members of such persons. It calls out a person who is in recovery from a substance use disorder. It incorporates a person who provides services related to the treatment of substance use disorder. So you can see where I'm going with this example. It draws this coalition in to these conversations. And again, we're going to be having them year round. So that bill passed unanimously out of the Assembly, and we have no doubt it will pass unanimously out of the Senate and be signed by the governor. Additionally, another bill just to call to your attention is Assembly Bill 158. This is Assemblywoman Monroe Moreno's bill to revise the penalties for persons who are under 21 years of age and have been found, for first-time offenses, been found in possession of alcohol or cannabis. And so we're just seeing, again, a refocusing and a shifting, not looking at jail time, but looking at treatment, looking at other alternatives, and helping to set those individuals on a different track. We have a handful, I know we're short on time today. We'd love to dive deep into all of these bills, but we have a handful of other bills that are also moving forward in the process. Senate Bill 69, which is the Washoe Regional Behavioral Health Policy Board's bill to certify a person who is providing or supervising peer recovery support services. That bill, Foundation for Recovery and Recovery Advocacy Project, have been so just integrated in since the beginning and have moved the ball forward on that, where we've got that bill. The policy has already been approved. Now it's in what's called a money committee, and that is just any bill that has any financial component to it after the policy is approved, it has to go through that committee. And so that's where that bill sits now. Another bill that sits in a money committee is Assembly Bill 370. That's Assemblywoman Dickman's bill on allocating some of the liquor tax revenue for recovery services. So we're seeing, again, just some of that money diverted from the general fund specific to recovery services. And then we've also got, I'm sure many of you have seen in the news, some of the opioid litigation that have infused some money into the Attorney General's office after having battled some of those pharmaceutical companies. $45 million is one of the latest settlements. So Senate Bill 390 is Senator Ratty's bill that will focus on the administration of that that opioid litigation funding. And her bill also will use part of that for the creation of a statewide behavioral health crisis hotline. So that bill also sitting in a money committee, as you can imagine, but we will be providing to Anna Maria and the rest of the team a recovery update that you'll see, or sorry, recovery-friendly legislative update that you'll see sent out probably later in the week. And we'll have links to all the bills so you can dive in as deep as you want. You can read them, and we are always happy and available to answer questions and just help walk anyone that's interested through the process so you can see where we are. Because as Trey said, 120 days goes by very quickly. And if it weren't for these deadlines, it would be pretty hard to keep everybody on track. So thank you so much for your time this morning. It's really exciting to be here and share this information with you.
Thank you, Leah. And thanks to everybody who is with us. I just have to call out because I think it's phenomenal. We are right on time. I mean, it's always great when we stay completely on time in TikTok. Anybody who knows me, I love being on time. So we're still on time with this schedule, which is phenomenal. You know, as you can all see, the work that we've been engaged in as a recovery community is really beginning to pay off. We're excited to see so many of these legislative initiatives inch closer to the finish line. And we're grateful for all the support from this community that has gotten us, the recovery community, this far. I'd encourage all of you to continue to stay engaged as we still have a lot more work to do, and we need all the help we can get. At the end of today's Advocacy Day, we'll provide some information on how you can stay involved in ways that you can keep up with these legislative initiatives as they work their way through Carson City. I now have the honor of introducing our first legislators who are joining us this morning. Some of them have been able to join us live, some of them because we're in the middle of session and they're going back and forth from committee meetings. Some have also provided some video messages. I think it goes without saying that without them, many of these great pieces of legislation would have not been possible this session. So we'll go ahead and kick it off with our first member of the Senate who's joining us live, and that's Senator Joe Hardy. Senator Hardy, are you there?
I am not only here, I can hear you loud and clear.
Wonderful. Welcome to Recovery Advocacy Day.
Thank you. You'll notice I've got a virtual screen going on in the background of what it looks like when you've been on something and you wish you weren't anymore. So would you like me to say something?
Yes, sir. The floor is yours.
Okay, so, you know, I've been involved with this concept of recovery for some time, probably all my medical career. And so I've thought about recovery and how it happens. And recovery actually happens by degrees. And if you consider the math of geometry, recovery, once you're in a position where you need to recover, you go in degrees. And so the recovery starts with a 45-degree change where you stop, you withdraw, you avoid, and you hear the common phrase of 28 days it takes in a recovery mode. So that 28 days is the 45 degrees. And then you go into a rehabilitation phase, which is a 90 degrees. And the 90 degrees is kind of like muscle memory. You start doing what you learned to do, and then you just go and do that, and you go slow. And you've heard the concept of 90 meetings in 90 days. So it's a 90-degree concept. And then you go into the next phase, I would call it the return, and the return is about 135 degrees. And that's when you're converted. You say, okay, I'm doing this well, and I need to help others. And that's, you know, a 6 to 12 month period of time where you realize you do care and you are converted and you are changing and you've changed. And then you come to a point where I called the resume your life, and you're at 180 degrees. And some people talk about 360 degrees. I don't want anybody to go back 100 or 360 degrees, because then you're back where you started with recovery or with a problem. So you need to resume at 180 days, 180 degrees rather. And then you just do life, except you do it better than you've ever done before. When you've recovered at 180 degrees, you're going further along than you ever were before. You've learned something you've never learned before. And so you've resumed life in a better way. And it's 180 degrees going forward instead of going backwards 360. And then I thought, okay, so how do you do it? You have tools that we use from a medical standpoint or a mental health standpoint, tools such as medicines like naloxone, naltrexone, buprenorphine, methadone. Those are all in different degrees. And then you have people, you have friends, you have family, you have doctors, you have bosses, you have the law, and then you have programs that are available, 12-step programs, service-oriented things, and you have being a sponsor yourself. And then ultimately, in this 180-degree change, you have your higher power. You have forgiveness. You learn to forgive yourself and forgive others, and in your process of forgiving others, you've learned to forgive yourself, which is probably harder than anything else. So as I look at it, that's the recovery process, and that's what we do and how we do it, and then we help others along that road. And that's my simple talk for the day, and open for any questions or teach me something, because I always like to learn something. Okay, Ryan, back to you. Thank you.
Thank you, Senator Hardy. Thank you so much for your support of this community, and we look forward to continuing to work with you. And thank you for your talk on degrees. I found that very enlightening myself. We are going to shift to our next legislators because we're waiting for some more to come in. We do have some pre-recorded messages from legislators who were unable to join us live this morning, and we'll go ahead and start with Senator Julia Ratty first. If we could go ahead, and there we go. Senator Ratty.
Hello, everyone, and welcome to Recovery Advocacy Day. I so very wish that you could be here with me in Carson City and that we would be all spending this time together. But I am just so proud of the work that's been done on recovery issues by advocates like you, even during a pandemic when we're using all different kinds of tools to get the word out to legislators in this building. And I just wanted to let you know that I appreciate you very much. Thanks to so many who leaned in to support Senate Bill 69 that I've been working on with the Washoe County Regional Behavioral Health Board. We hope that that policy to do some more in terms of substance use disorder prevention and to build our peer workforce is going to be a good policy that makes it to the end. So again, thank you for that. And of course, we'll do everything we can to keep recovery in mind as we're working on other behavioral health bills that go through the session. So again, thanks for staying engaged, and I hope you have a great Recovery Advocacy Day. I appreciate you all. Thank you.
Thank you, Senator Ratty. And we do have another legislator who's just joined us live. I'd like to introduce her. She's done a lot for us this session and has some great legislation moving forward. Assemblywoman Jill Dickman, are you with us?
I am. How are you all today?
Good to see you. The floor is yours, Assemblywoman.
Good to see you too. Well, thanks for letting me interrupt your event today to speak to you for a minute. We're all here because we know how important recovery support services are for the people who need them most. We have to do everything we can to make sure that the recovery journey doesn't end at the door of a treatment facility. I know that your priority, as it has been one of my priorities this session as well, and I want to thank you all for your work and your passion for helping our fellow Nevadans. As some of you may know, I sponsored Assembly Bill 370 this session, which would allocate money to DPPH for community providers to offer more of these important services. Unfortunately, through the legislative process, the bill has been amended and the amount of funding significantly cut. But it's my hope that we can still get the bill passed so we can establish this program at DPPH and show the legislature that, that these programs and services work not only for the people who need help, but also to save our state money in our underfunded behavioral health systems. So thank you all again for your time and for your work. I hope you have a great meeting and enjoy your day. I wish you could be here in person because we'd like to see all of you.
Well, thank you, Assemblywoman, and we can't wait to be back in person as well. And as soon as we're able to, we will be back up there in Carson City. And thank you for all the work and for standing with the recovery community and just being a tireless advocate for us. We are incredibly grateful. Our next legislator who is super busy, and many of you know him. He's done a lot of work with Foundation for Recovery and the Recovery Advocacy Project and has been a great advocate for our issues, is Assembly Member Steve Yeager, who offered a video. If we could go ahead and roll Assemblyman Yeager.
Good morning, everyone. I'm Assemblyman Steve Yeager, and I'd like to welcome you to Recovery Day at the Nevada Legislature. I wish we could all be here together in person, but obviously the world had different plans in store for us. But the hard work continues, and I want to thank you for all of your work on behalf of the recovery community. Please know that we are also working hard at the legislature to treat this issue for what it is, a mental and behavioral health issue. We're working hard to make sure that offenders get appropriate treatment. They don't need to be in the criminal justice system, they need treatment. And that includes our minor offenders. We're working on lessening penalties and getting them help. I'm confident that with your help, we're going to get this right as we continue to move forward this legislative session. So again, from the bottom of my heart, thank you so very much, and have a great Recovery Advocacy Day at the Nevada Legislature.
Thank you, Assembly Member Yeager. And before we go to our next panel, we have one more message. Assembly Member Dr. Robin Titus.
Good morning. I'm Dr. Robin Titus, and I serve as the Assembly Republican leader in the legislature. As a 37-year career family practice doctor, I particularly want to thank you for participating and wanted to virtually wish you a welcome to Recovery Advocacy Day. I wish that we could be in person in Carson City, but fortunately, we've all become quite good at Zoom over the past year. I would like to thank everyone for your interest in advancing recovery-friendly policy. I recently participated in the DEA's National Prescription Drug Take-Back Day because I know too often substance misuse begins in the home medicine cabinet. I will continue to keep the recovery community in mind when it comes to your continued work on behavioral health issues. Thank you and stay strong.
Thank you, Dr. Titus. And now I'd like to pass the virtual stage back to Sean O'Donnell for our next panel, which I'm really looking forward to, on recovery resources in our state. Sean?
Thank you, Ryan. Oh my gosh, it was so awesome to hear from all of those legislators who joined us to share some messages about the work that we've done as advocates this session and in previous sessions. So really, really awesome to hear from all of you. Thank you so much. So now we'll be jumping into our recovery in our community panel. And as Ryan had mentioned, we are joined by not only advocates, but by different providers in our state who are doing incredible work on the ground to help turn the needle just a little bit more in the right direction when it comes to recovery and support services. So today we have Cindy Farnes. She is a peer recovery support specialist at Foundation for Recovery, Chelsea Cheatham from Track B Impact Exchange, Bob Vickery from the PACT Coalition, John Newell, the project director of the Building Communities of Recovery program, and he is also a peer recovery support specialist at Foundation for Recovery. And we have Walter Saunders from Rural Nevada Counseling. So welcome, everyone. Thank you for being here today. So let's go ahead and just hop right in. I have a few questions that I want to open up to the full panel. Would each of you mind going around and sharing a little bit about your organization's work and what you do in the community? And Bob, we could go ahead and start with you.
Hello, everybody. Thank you, Sean, so much. My name is Bob Vickery, and as mentioned, I am a project coordinator with PACT Coalition. I'm also a person in long-term recovery, and I wish I had all the time in the world to express the gratitude and hope that I have heard here today. It is just incredibly, it has infused me with just incredible energy to do this good work. And I thank everybody. So for those of you, many of our participants and stakeholders of PACT Coalition are on the call today. So I'll do my best to be brief about who we are in the community. But we are a coalition for a safe and drug-free community, and we're a nonprofit 501c3. And I think the most important thing I can say about PACT is that I've discovered since I've been on the team is that we bring community organizations, leadership, agencies together to strengthen the community by acting as a neutral convening table. And that's a term that Jamie Ross has, impressed upon me, our executive director. So when I'm out representing the community, it was mentioned, we are nonpartisan. We bring together over 70 organizations and agencies together around the table every month. We used to do it in person. We hope to do it soon. And we work to address emergent issues around substance misuse by offering resources of prevention. We're a pass-through agency for federal and state funding. And our work is to get these resources out to the agencies that are boots on the ground, doing the good work in the community to try to reduce all of the things that we talked about today. Not only our opioid epidemic that's claiming so many lives, to try to reduce death and overdose and injury, but also to try to remove stigma in our community and increase language so that folks understand the significance of the work that we need to do in the community. So I'm very proud to be part of PACT, and I'm very proud to be part of our discussion today. Thank you.
Thank you, Bob. And thank you to PACT Coalition for really helping be that connector in our community and bringing multiple organizations together to address this issue in our community. Next, Chelsea Cheatham, do you want to explain a little bit about Track B and what you guys do?
Yes. Hi, everyone. My name is Chelsea Cheatham, and I work at Track B Exchange. Thank you very much for having me as a part of this panel today. Track B Exchange is a harm reduction program. So harm reduction is when you reduce your risk of a negative consequence for something that someone is doing. So in our program, we're a syringe exchange. We're the only syringe exchange here in Southern Nevada currently, and we provide people with a stigma-free supportive environment for people who use substances to get the supplies they need in order to stay healthy. We wanted to provide people with education and tools and a place to seek help and to ask for treatment when they're ready. I also co-chair the Southern Nevada Harm Reduction Alliance, which is a great group of people and organizations, many of whom are on this call today. And we're a group of harm reduction groups, treatment providers, recovery organizations, people that are all in recovery as well as allies, and we're all working together to meet people where they're at in their lives, including their journey to treatment and recovery. And we do that by taking information and services to people exactly where they are.
Thank you, Chelsea. Yeah, and I love that you had brought up the Southern Nevada Harm Reduction Alliance as well. I think that we've sort of heard this resounding theme from other people. Alvin had talked about this, Vin had talked about this, and so had Susie, about getting involved, right? And getting active and participating in some of these groups that are meeting and kind of find your niche and where you want to belong and doing some valuable work. And the Southern Nevada Harm Reduction Alliance is just another group that anyone can participate in if you're interested in harm reduction, right? And getting that information out to communities. So thank you, Chelsea. Cindy, do you want to go next?
Hello, everyone. I'm Cindy, and I am a peer support specialist and person in long-term recovery. I currently am working with the awesome organization Foundation for Recovery, and super excited to be a part of this Advocacy Day. It's been mentioned a lot about having a voice through different participants in this format. And I think it's super important because by us sharing from our experience and strength and hope with other people in recovery, like we give them the courage to do the same. And substance use disorder and mental health struggles, they do not discriminate. So I think that it's important to realize like this is a complex issue. You know, but it's also a human issue, and there's so many different pathways through recovery, and the Foundation for Recovery supports many of those pathways. And working as a peer support specialist, I think it's important to the bills that are being passed as far as having a credential, like holding us accountable, making us sustainable in the community, because there is a gift in that lived experience, where we can help bridge gaps, especially out in like rural Nevada, where there are the need for more resources. We can kind of be out in those communities and we can help give those people a voice and help to bridge gaps in hopes of establishing more of a continuum, and not just helping the person recover, but helping our communities to recover as a whole from, the issues that are created by substance use disorder, removing the stigma, giving people the resources, coping skills, tools, all the different things, So we as peer support specialists work in a non-clinical setting, but we are perfect for that gap between that human being and the clinical and what happens in between, and helping to connect all the dots. So I'm just super grateful to be part of this solution, to be part of such a group of amazing individuals. And thank you for all using your voice to make a difference. I can't, but we can. So thank you.
Thank you, Cindy. We're so glad that you're here today, and I'm so grateful that you are a member of our team. I know that you're doing great work out in rural communities where you travel on a weekly basis to go offer things like peer recovery support, different all recovery meetings, recovery yoga, naloxone trainings out into these communities. And I love what you said about how we can help bridge that gap, right, between the human and maybe higher levels of care. And that's really the point behind like indigenous organic recovery support services, is that it's inherently low barrier, right? We know that in almost every single community, people like us exist, and giving them the tools to be able to share freely with other people who might be struggling how to find and access support is so, so valuable. So thank you for your words. Walter, do you want to go ahead and introduce yourself and your organization?
Sure. My name is Walter Saunders. I work for Rural Nevada Counseling. I'm a licensed social worker, licensed alcohol and drug counselor, and a mental health therapist. And we're out here in Lyon County, Nevada, which is one of the largest geographical rural areas in Nevada. I think we're probably about 100 square miles or something like that. And we have 4 offices out here. And I live in Reno, so I travel for the last 6 years out to rural pretty much every day. We are one of about a dozen, what the state now calls behavioral health centers in Nevada, which is a newer concept. It's still in its early days, but it's a new concept from SAMHSA, which is the federal, substance abuse mental health services agency. And it's amazing. As mentioned earlier, one of the biggest challenges we have in the rural community is access to services. And it's even more pronounced in the rural community because, Reno and Las Vegas, if somebody's seeking recovery, they can kind of jump on a bus or a bike and go somewhere. And that's not quite the case when your area is about 100 square miles, And so the behavioral health center is also a bit different for those that are in long-term recovery from many years ago. Treatment providers tend to be siloed back then: mental health over here, substance over here, targeted case management over here. And of course, every over here is another place that a person seeking recovery falls off because they don't make their appointments, or, they just get burned out and they don't want to return. The behavioral health centers allowed us to put everything under one roof. So we have medication prescribers, we have a Medicaid assisted treatment provider on staff for, methadone, Suboxone, Subutex, Vivitrol, psychiatric medications if needed every week. Of course, one of the exciting things that we do is we have peers. I believe I now have 16 or 18 peers on staff. They drive the vans out to clients' houses, take them to appointments, just really engaging that role. Peer support specialists, peer recovery specialists are so critical. they're that bridge between, you know, the counselor and the therapist and that person in early recovery, that motivation, that support. And we also provide 2 transitional living homes out here in rural Nevada. Previously, you know, when an addict needed these types of services, we kind of sent them to Las Vegas, to Reno, because they had more resources. But really, that's a punishment to the addict seeking recovery, right? We're taking you out of your community, out of your job, and we're going to send you to another town. Even though the treatment provider had the greatest intent, which was to connect them to resources, it could be viewed as punishment. It disrupted families. And so having these homes in the community in which these, you know, clients reside has been, you know, a game changer. And so, yeah, we're just hoping that these behavioral health centers will catch on. They give us a lot more resources, and also gives us the ability, you know, previously you went to treatment, here's the curriculum, we do this for everybody, and that's the way it is. And as it's been stressed on this call by many people, including Dr. Woodard, every path is a different path. And so you kind of have to be able to give the providers the ability to meet the clients where they're at and come up with their own individualized paths. And these behavioral health centers really allow us to do that with case management and peer and basic skills training and a lot of those things that we do. So that's kind of what we do here in Lyon County.
Awesome. Thank you, Walter. A lot of great work along that whole continuum, it sounds like, of care out in the rural communities. And I will say that we are coming up on time. These panels go really quickly, so we'll keep moving on with programming, but I will introduce John Newell as well. John, do you want to go ahead and introduce yourself and some of the work that you're doing out in communities?
Absolutely. My name is John Newell, and I'm a person in long-term recovery. And what that means for me is that I've been drug and alcohol free for over 19 years. There's not really a lot that I need to add to everything that's went forth already. Sean, I'm looking at you. It's been my experience that my internet connection is a little unstable here. Actually, so if I do freeze, give me some jazz hands or something. Just got a message that it's unstable. But so I'm actually currently in Hawthorne, Nevada right now, working in a satellite location where my internet is a little unstable. Get it? And Cindy pretty much summed up everything. What I will add is that through the initiative that we are working on, B Corp, which stands for Building Communities of Recovery, like our intention and our focus is to bring into rural and frontier counties throughout the state of Nevada, where there's already a limited amount of services. We're just here to add to the menu. We're here to plug in gaps and fill in holes wherever there are things that are like all of the free services that we provide. And I will say, you guys, this particular location that I'm working out of today in Hawthorne, Nevada is very near and dear to my heart. And it's an honor and a privilege that I get to travel here every other week. So for the sake of time, Sean, I'm gonna wrap up there and give it back to you.
Thank you, John.
Sean, are you there?
Yes. Thank you so much for explaining a little bit about what you're doing. Cindy's actually on that B Corps team as well. And one thing I'll just say that our experience has been going into rural communities and working with rural communities, adding to that menu of services, as John had mentioned, is faith-based organizations have really opened up their doors and been welcoming to be able to provide space in the community and work with us. And that has just been an incredible experience. And it goes back to what, it really echoes what Dr. Woodard had said, what the governor has said, what I had said in opening remarks, as far as making these services a part of our everyday environments, right? That someone doesn't need to necessarily go to a separate spot to access these services, but they exist where they work, live, and play, right? So I will say thank you all again for being on today's panel. And for this great discussion. I'm sorry, but we have to move on. And again, I had over planned with like 10 other questions to ask everyone. And I really wish we would have got there, but maybe at another time we can hop on and do this again.